You read that story surprisingly professionally, Raul Martinez. I am impressed. All right, it is time for Ask the Derm. Board-certified dermatologist Dr. Billy Groff from Cosmetic Laser Dermatology is here to answer all of your skin questions. We have to talk about, first of all, the FDA approving this double chin injectable that's supposed to be the cure-all for the double chin.
Well, it's a great medication. It's called Kythera, and we were fortunate enough to be one of the 11 centers in the U.S. that actually studied and researched the medication, so we know a lot about this stuff. But basically what it is, it's a medication that we inject into the double chin area, and it dissolves and breaks up fat. So the beauty of it is that it's very quick. It only takes maybe 5 minutes to inject the area. You can see results in as little as 2 weeks.
Wow.
So what happened was the FDA advisory panel voted to move forward with granting them FDA approval, which means it's still going to be another probably couple of months, but we should have it by the springtime.
Very good. Yeah. Okay, let's go ahead and get to a couple of questions. We're going to start first with, last spring I got a temporary tattoo on the beach and my skin got this crazy reaction to it. Can I get one this year? This is Sandra from Del Cerro who wants to know. And I think we have a picture to show you what we're talking about right here. Okay, interesting.
Yeah, so what we're doing, we're just going to be talking a lot about spring break kind of issues today. And one of the issues with spring breakers is they get these henna tattoos. Now the problem with henna tattoos is oftentimes we don't know exactly what ingredients are going into it, and a lot of times there's things other than henna, and you can get really bad skin reactions, almost like a burning and blistering reaction. So I would advise absolutely against getting any more of these tattoos because this patient's already reacted once and most likely will react again.
It's going to happen again.
Definitely.
Right. Okay, let's get to our next question. I work out a lot, but I have a slight bulge on my outer hips. I don't want to do lipo. Is there anything else I can do to make this better? Jenna from La Jolla wants to know.
Yeah, Jenna's another spring breaker that has this little bulge here in the outer hip, and they call it saddlebags or what have you. But liposuction's excellent, but if you want something that has no downtime, there's a newer treatment called Coolscupting, which Coolscupting itself has been around for several years, and it's proven it works. But we just got this handpiece to treat the outer hip, and you can see how it flattens and takes that bulge down. This is a patient that had one treatment at our office, and you can see that bulge looks much better.
Interesting. Okay, next question. I was drinking Corona, and I spilled it on my leg. I noticed this weird brown patch on my leg a few days later. What is it? Jim from PB.
So Erica, I want you to imagine yourself on the beach right now, and you have a Corona. What do you usually enjoy?
Lime.
There you go. Oh, very good. So,
did I answer that too quickly?
Yeah, that was really, you're on top of it. Yeah, I don't know, that may be a sign. But anyway, lime juice, when it comes in contact with the skin and when it's exposed to sunlight, you can get this phototoxic reaction. So it's like a really intense sunburn. And it, again, can become very red, itchy, it can blister, it can even leave a scar. So if you're ever outside at the beach and you get lime juice on yourself, you should either go in the ocean or go to the pool and wash it off, because you can get a really nasty reaction.
Interesting. I had no idea. Okay, lastly, please help. I have tried every kind of deodorant and I still have bad body odor. I'm going to be at beach parties and I feel discouraged. Sebastian from UTC wants to know what to do.
Well, Sebastian, we have a great solution for this. Oftentimes, if patients do have this problem, there's no deodorant that can help. We can inject Botox into the armpit area.
And that'll help with the smell.
Not only does it shut down the swelling, but the sweating, but because there's no sweating, there's no body odor. Okay. So it shuts it down 90 to 100%. It's amazing.
Dr. Groff, thank you. To get in touch with Dr. Groff, the information is on your screen. We've also linked it to our website, fox5sandiego.com. All right, Raul, over to you.